this week we have a good range of very clinically applicable studies. At the number 3 spot, we have a new simple risk score for pulmonary embolism. This is something that we now apply risk stratification to, where higher risk patients may benefit from thrombolysis or even surgical embolectomy. And so developing a risk score has been helpful. There's a more complicated score that performs well, but investigators in the archives published a simple score that includes 6 points with age over 80, cancer, a history of heart failure or COPD, heart rate over 110, blood pressure less than 100, or oxygen saturation less than 90. And so counting up that score, one can predict mortality and then use that in deciding on more aggressive treatment potentially. It needs to be validated prospectively, but a nice simple score that could be clinically useful. And having had 3 patients admitted to me yesterday with large pulmonary emboli, this will be very useful in trying to sort out how to manage these patients. Well, at the number 2 spot is a big study, pun intended, on waist circumference when controlling for BMI. A study of over 100,000 patients looking at the contribution of waist circumference over and above BMI, finding about a 15% or 20% increase in the risk of death for every 4 extra inches in the waist circumference. This was particularly bad for people whose waist circumference were greater than 48 for men or 43 for women, but again, there was a graded response. And so attention should be paid not only to weight, but also waist circumference, something obviously easily measurable, but a good discussion point, I would say, in the office with patients. And at the number 1 spot is a terrific new document by an ESC working group on acute cardiac care on the use of troponins. This is one of a series that they're developing on biomarkers, and we on CardioSource have a brand new biomarker website that has all the information of the literature and hot topics, and Michael Contos is the editor of that page. Now, this new document focuses on troponin and gives a lot of very practical advice on looking at the laboratory values and having clinicians talk with the lab to sort out, do you have a current up-to-date assay? But it also gives good advice on how to use this. It has a list of the other diagnoses beyond acute MI that can lead to elevations in troponin and guides us as to where it can be helpful and the importance of looking for the rise and fall of troponin in order for it to be more typical of myocardial infarction. And so a terrific new document to help use of this widely applied biomarker. I'm Chris Cannon with this week's CardioSource Video News.